An advocacy guide has been developed and presented to enhance efforts of civil society organizations and communities in malaria interventions. The guide, which was coordinated by the Civil Society on Malaria Control, Immunization and Nutrition, aims to ensure accountability in malaria projects across the country. Kemi Balogun has more on this.
Rukayat Ibrahim is worried by how frequent her one-year-old son comes down with malaria, and the symptoms seem to be unending.
Malaria comes too often. We don't know if the mosquitoes come with a different kind of disease. My child has been sick, and even after treatment, malaria comes back.
She claims the huge amount she spends on buying medication and insecticides has become a burden. The launch of the Malaria Advocacy is one of the tools provided to enhance accountability of all malaria interventions, especially at the community levels, through raising awareness on prevention, testing and treatment. ACOMIN has been tasked with the coordination of efforts of CSOs on oversight, advocacy and accountability at all levels in order to ensure help reaches mothers like Rukayat and her children.
The people who are most affected by malaria are women, pregnant women and children under 5. All of these are from communities, these persons from communities. So the community members are now beginning to see themselves as contributors to their own health outcomes.
In the health facilities in 30 states covered by the Global Fund and 11 states covered by PMI, which is 24 states in Nigeria, that drugs for treating malaria, tests for testing if a patient has malaria is free.
The 2019 World Malaria Report states that Nigeria accounts for 25% of the global malaria burden and 24% of all deaths from malaria globally. It is estimated that about 97% of Nigerians are at risk of a malaria infection, while about half of the population will have at least one attack of the disease every year. With these numbers, there is need for accountability across board.
There is every tendency that if community are not monitoring the commodity, either at the point of distribution or at the facility, some individuals are taking advantage.
The document is expected to be used as a guide for effective advocacy for relevant stakeholders, policymakers, influencers and gatekeepers for accountability in malaria interventions. This is expected to contribute positively towards the elimination of malaria in Nigeria. Kemi Balogun, TVC News, Abuja.